Well, we are here talking about the impact of COVID, more specifically on the minority population and the Latin population as well. So joining us this morning is Dr. Brandon Yan, family physician. Good morning to you, doctor.
Morning. Thanks for having me.
Good morning. Okay, and tell me more specifically, you're with CPN Family and Internal Medicine. Is that correct?
That's correct. We're located in Speedway.
That's wonderful. Well, let's talk about the impact right now of COVID-19. And as I said, more specifically, the Latin population, because you guys are really doing a lot to try to help.
Yeah, definitely. And that's obviously a population that we really want to get the vaccine and historically hasn't got the vaccine as much as other populations.
Are there specific reasons for that you guys are seeing?
I think a lot of it's misinformation. I mean, that's across the board. Concerns about hearing different stories and reading things online that aren't necessarily true.
Right. Hesitations, right? Not sure how to handle that. You told me that the clinic in Speedway, you're starting a new platform. Tell me a little bit about that.
Yeah, sure. We're trying to increase access to Spanish-speaking patients, including staff, a Spanish-speaking call service, physicians that speak Spanish across family medicine, OBGYN, orthopedics, diabetes, multiple different specialties.
Yeah.
So we're hoping to increase access.
That is so incredibly important. What do you guys hear a lot of times from our Latin friends, minority friends, about maybe some of their biggest obstacles in, dealing with their healthcare and what's right for them?
Sure. A lot of it's just being able to get the right information. A lot of it's access, providers and staff that speak Spanish.
Mm-hmm.
We're going to implement pay scales as well for people that have difficulty getting insurance.
Oh, nice.
So yeah, we're hoping to really be available for them.
That's really great. Okay, I want to get into the pop-up clinics because you have some of those coming up as well. I believe the one on June 5th, right?
Yeah, I believe it's at the Lawrence Community Park.
Yeah, Community Park.
Yeah, 8 to 10.
Okay.
They'll have the Johnson & Johnson vaccine available. First come, first serve, no appointment necessary. Sure, and probably the biggest thing I've had talking to my Spanish-speaking patients is concern about the new vaccines and the technology. And what I tell my patients and what I'd love to encourage everyone is that this technology's been around for over a decade. It's not necessarily new. It wasn't rushed. It's just the opportunity arose to use it for COVID and to be able to implement a vaccine quickly. So I feel that it's very safe. And this technology is going to be used going forward to make lots of new vaccines probably in the future. It's been used in the past to help with Ebola. So it has been tried and tested in other ways. And I think it's really safe and will keep people healthy.
What would you recommend if they just simply have questions and they do want to talk to somebody just to, ease their concerns, right? I think a lot of times we just want someone to talk to and to genuinely listen.
Sure. And, first of all, I'd really encourage them to find a PCP, primary care doctor, and voice those concerns. Also, the CDC website has lots of great information.
Okay.
The Indiana website, coronavirus.in.gov, has tons of information and can answer a lot of questions that people have.
Well, you genuinely seem like you care, and that is appreciated so much. So we thank you for that. Again, the pop-up clinic, June 5th, as you said, 8 to 10 a.m. at the Lawrence Community Park in the community building. And you say 50 to 100 doses, J&J vaccine, first come, first serve, and no appointment necessary?
You got it.
Okay, perfect. Doctor, thank you so much for your time. We appreciate it. We will put all of this information on our website, indystyle.tv. Thank you for everything that you're doing.